When you lose substantial weight, your body doesn't necessarily celebrate with you. It's actually mad at you. Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. You did it. You started Ozempic, Wegovy, Mounjaro, Zepbound, or another weight loss medication. You lost 20 pounds, maybe 40, maybe even 70. Your blood pressure improved, your clothes fit again, maybe your A1C came down, and now you come into my office and ask me the question I hear all the time. Doctor, I am at my goal weight. When can I stop the medication? And my answer sometimes surprises patients, because reaching your goal doesn't necessarily mean the treatment is finished. In many ways, this is where the harder part begins. So let's look at the problem, okay? Because for years, we've treated obesity differently from almost every other chronic disease. If I give you blood pressure medication and your blood pressure goes from 170 to 120, you don't usually come back and say, "Great, my blood pressure is now normal, let's stop the medication." Why is it normal? Partly because we are treating it. If your cholesterol falls dramatically on the statin, we don't conclude, "Fantastic, you are cured, throw away the statin." But with obesity medications, there is still this expectation. I lost the weight, now I should be able to stop the medicine and keep everything exactly the same way it is. For some people, maybe, but for many people, that's not what happens. And we now have very good evidence showing us exactly why. So let's get into the science, okay? And let's see what happens when you stop the medication. Now, let's talk about semaglutide first. Now, in an extension of the Step 1 trial, participants taking semaglutide, which you know as Ozempic and Wegovy, lost an average of about 17% of their body weight. Then, treatment stopped. 1 year later, they had regained approximately 2/3 of the weight they had previously lost. And many of the improvements in cardiometabolic risk factors began moving back toward baseline. Now, let's look at Tirzepatide, which you know as Mounjaro and Zepbound. In the Surmount-4 trial, participants initially lost about 21% of their body weight. Then researchers divided them into two groups. One group continued Tirzepatide, the other group was switched to placebo, which is like sugar pill. Now, over the following year, the people who continued Tirzepatide lost another roughly 5.5% of their body weight. Now, how about the people who stopped? They regained about 14% of their body weight during that period. So the message from these trials is pretty clear. For many patients, stopping treatment means some degree of weight regain. And now the patient will ask me, "But doctor, I changed my lifestyle." And this is where patients sometimes become frustrated with me. "Doctor, I learned how to eat." "I know." "Doctor, I am exercising now." "Excellent." "Doctor, I don't eat the way I used to." "Wonderful." Keep doing all those things. But I need you to understand something. Weight regain does not automatically mean you failed. Obesity isn't simply a knowledge deficiency. Most of my patients know vegetables are healthier than French fries. Everyone knows that. Nobody needed medical school to figure that one out. The problem is that the body weight is biologically regulated. When you lose substantial weight, your body doesn't necessarily celebrate with you. It's actually mad at you. Appetite can increase. Satiety can change. Your energy requirements are lower because you are now carrying a smaller body. And the medication that had been suppressing appetite and helping you regulate food intake is no longer doing that job. Suddenly, you notice something you haven't experienced in months. You are hungry again. And that is the return of the proverbial food noise. Patients describe this very beautifully. They tell me all the time, "Doctor, before the medication, I thought about food all day." Then they start treatment and suddenly, I can eat half the meal and stop. I don't think about snacks anymore. I walk past the cookies and I don't care. Then they stop. And for some people, that old conversation in their head starts coming back. What's for dinner? Is there something in the refrigerator? Maybe I'll have a snack. Maybe another one. And patients sometimes interpret this as, "I've lost my discipline." Nope. The biological environment changed. That distinction matters because shame is a terrible long-term weight management strategy. Okay, so let's ask ourselves something. Does this mean I have to take Ozempic forever? This is probably the question everybody wants answered. And the answer is not necessarily, but possibly. I don't think every patient who starts a GLP-1 medication automatically needs the exact same dose for the rest of their lives. Medicine should be individualized. Some patients may continue their therapeutic dose long-term. Some may eventually maintain on a different dose or strategy under medical supervision. Some may discontinue treatment and successfully maintain much of their weight loss. And others may discontinue, regain significant weight, and need treatment again. What I don't want is this. You reach your goal weight on Friday, you decide, "I'm done," and simply stop treatment without having any maintenance strategy whatsoever. That's not the plan. That is an experiment, and your body is the experiment. And that experiment is bound to fail. So what are we actually treating? Let's come back to the beginning. When we talk about treating obesity and losing weight, what are we actually treating? Because this is why I think our entire conversation about weight loss medication needs to mature. The goal isn't make the scale display a smaller number. The goal is health. If you had diabetes before losing weight, what happened to your A1C? If you had hypertension, what happened to your blood pressure? If you had sleep apnea, has it improved? If you had fatty liver disease, what happened to your liver? What happened to your waist circumference, your mobility, your knee pain, your cardiovascular risk? How about your quality of life? That's what I'm interested in. Because if the weight returns and those metabolic improvements disappear with it, we haven't maintained the treatment benefit. A more recent analysis of Surmount 4 found that greater weight regain after Tirzepatide withdrawal was associated with greater reversals of improvements in things like waist circumference, blood pressure, cholesterol, and glycemic measures. So this isn't simply about whether your genes still fit. Okay, now let's talk as physician and patient, okay? This is our allyship part of this podcast. Because I want to talk directly to the patient who regained weight after stopping one of these medications. Please, don't walk into my office embarrassed. Don't tell me, "Doctor, I messed up everything. I regained all the weight." Let's figure out what happened. Did hunger return? Did your activity decrease? Did you lose muscle during weight loss? Did your sleep change? Did stress increase? Did your eating patterns change? Did the medication become unaffordable? Did your insurance stop covering it? There are dozens of reasons, and I hear them every day. Our job isn't to judge the regain. Our job is to treat it. I always tell patients, weight loss is not a sprint. It is a marathon. And our job is to support you along that marathon. We are the guys cheering you as you run the marathon. Okay? Now, let's talk about something else, because actually, I think the maintenance conversation should begin before you actually reach your goal weight. And I talk about this with patients all the time. If you are 10 or 15 pounds away, I am already thinking, what's the long-term strategy for Rebecca? What is the protein intake for Veronica? What is resistance training going to look like for Samuel? What happened to Robert's waist circumference? How much muscle must Mark preserve? What are Annette's eating patterns and what she should be looking for when it comes to appetite changes? What will we do if she regains 5 pounds, 10 pounds? At what point do we intervene? That is medicine. Medicine is not, congratulations, you lost the weight, see you next year. No, sir. Okay? So, this is the action plan I want to leave you with on this episode. If you are currently taking one of these medications and approaching your goal weight, here are the questions I want you to ask your doctor. Number 1, what's my maintenance plan? Don't just ask, when do I stop? Ask, what happens after I reach my goal? Number 2, what health markers have improved? Know your numbers, blood pressure, A1C, cholesterol, waist circumference, whatever applies to you. Number 3, how am I protecting muscle? Because losing weight isn't enough. We'll talk much more about that in another episode. Number 4, what happens if my weight returns? What happens if my appetite returns? Plan for it before it happens. And finally, number 5, what amount of weight regain triggers action? Don't wait until 40 pounds have returned before calling your doctor. If the trend changes, address it immediately. And I always tell patients, 5 pounds is the limit. If you gain 5 pounds, call me right away. So as we wrap up this episode, I want you to know that weight loss gets all the attention. The before and after pictures get all the attention, the smaller clothes, the number on the scale. But clinically, weight maintenance may be the more important achievement because losing 50 pounds for 6 months isn't nearly as valuable as maintaining a healthier weight and better metabolic health for the next 10 years. So if you've reached your goal weight on Ozempic, Wegovy, Mounjaro or Zepbound, congratulations. Seriously, I'm not joking. I'm super proud of you. But don't ask only, when can I stop? Ask the better question. How am I going to keep what I have achieved? Because reaching the destination is one thing. Staying there is the real work. I'm Dr. Albert Takem, and that's your daily brief. I will see you next episode because the fight for your health doesn't stop here. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.